everybody out there. I'm gonna drive and do a video at the same time. I just got back from the doctor, headed to a different appointment now, but I saw my hiatal hernia repair doctor, and I'm doing well. Stitches are healing well. There's still some leftover parts and stuff, but dissolves and such, so no problem. He said it was healing fine, no concerns whatsoever. He did a quick breathing check with the stethoscope and whatnot, and no issues. He asked if I was swallowing, drinking okay and stuff like that, and was I ready to go on a soft food diet, and I said yes, and he said okay, sounds good. And again, I think that because I had a dual procedure where I had a hiatal hernia repair and the TIF, the two doctors, two different concepts, and it's relatively, I think, new to these doctors to do it this way, and so that's where there's the discrepancies between what the doctors are saying or whatnot, and what they're doing, and diet discrepancies and such. So he said, yeah, go eat some soft foods you can have for about a week or so, and then you can get back to some regular food. And my eyes opened real wide. I was like, wow, really? But I said, well, I've been following this diet guide from the TIF doctor, and I handed it to him. I took it just in case, and it's pretty strict. And he said, well, yeah, I mean, we're still, how did he say, we're still trying to figure out what the best plan of action is for these dual procedures. So I mean, he pretty much admitted that it was new and they're unsure. So he deferred back to the diet guide and said something about well, you could stick with this, then they will be using extra caution, essentially. So I think I would have really questioned if he said, oh no, don't worry about it. I would have asked the TIF doctor, and then I'm sure the TIF doctor would have said, no, you need to stick to the diet. Like I mentioned in previous videos, the TIF doctor had said you really, really, really have to baby this for the first month. So anyhow, I'm cleared to have soft foods. I woke up and had like a protein shake this morning, so I really haven't had eggs or oatmeal, and that's what I get to add today on day 15, which is today. Eggs, oatmeal, cottage cheese, ground turkey, really finely ground fish. I'm trying to think of what else I can add. Mashed vegetables, non-stringy and less liquidy mashed potatoes, stuff like that. So I mean, just being able to have eggs and oatmeal for breakfast, and ground turkey and ground fish, and it says turkey as an example, but I would imagine you could probably get a ground beef, anything ground something, as long as it's soft, so that feels more like a normal diet versus the mush and the liquid diet that I've been having. So I'm encouraged and very happy about that. My energy level, I think I mentioned in previous videos, has returned. I still struggle with it a little bit, but I'm not eating much still. Again, a half a cup 5 times a day. I still think the diet book says a half a cup 5 times a day. Now it's just soft foods. So I can still have the other stuff in the diet, like ice cream and soups and puddings, but I don't know that I will, unless I just don't want to have anything. But I really doubt that's going to be the case, because it's just exciting to be able to have some food that's actually food. So it was a quick 2 weeks, but it was a slow 2 weeks, if that makes sense. And now just being able to just get back to some normalcy, which is all I want. So that's energy level. Food that I'll have, again, I haven't tried yet to see how I've been able to tolerate it. That's the other thing, bananas, melons, and berries, things like that I can have as well. Any soft sorts of fruits, and I think you can have like steamed vegetables as long as they're really soft. Probably not like the florets of broccoli, but you could probably have some broccoli, I would imagine. That's a little odd to me, but like a carrot that's kind of mashed or really cooked really well, soft, of course, like a consistency, texture of eggs, I would imagine would work too. But I don't know that they sell those in a steamer bag, but otherwise you could steam them how you steam them and have carrots or something like that too, just for some variety. But let's see, pain levels. Again, my sutures are fine. I feel a little stretch here and there around the surgical sites of the scope, but those are fine. I get a little bit of stretching, not around the surgical sites, but they're jabbing things around. They're not being really gentle with you. I mean, imagine you're flopping around when they're putting the scope in you and shoving it in. I mean, they're not gentle, I'm sure. If you saw it, then I'm sure that you would see that kind of stuff, and that's probably why you don't see probably many videos of a procedure from like a nurse's perspective, because the way you're flopping around and your body's moving. I haven't looked, maybe you can, but I would assume you don't see that very much. But so some tenderness there a little bit, but otherwise, again, I've never taken a pain medication. I haven't taken Tylenol in weeks. I've taken ibuprofen for other pain that's not really associated with the surgery, but I think it was once, and that was it. So that's good. In terms of the gas pain that I've been feeling, I did start taking some Gas X. I'm not sure if it helped or not. I still have the gas pain and the gas bubbles, as I've been calling them. It's kind of not as low in the chest, upper part of the stomach, lower part of the rib cage anymore. It's almost higher up and even into my upper part of my rib cage and my chest, and even into my throat. But again, I addressed that with the doctor. He had no concerns. It's normal. I think something about 6 weeks usually for that kind of stuff to go away. He didn't bat an eye. He kind of knew the questions were coming. He didn't address them. I had to ask. But and then let's see, other symptoms like the white tongue. I've talked about that in the past. Scraping it off, using mouthwash, brushing my teeth more often. That has helped. My water brash has pretty much gone away. Intermittently, it's here and there, but pretty good. The saliva, the same, which is the water brash, again, gone away pretty much. Let's see, sour taste, again, I think that was more associated with the white tongue. Good thing my wife noticed and told me. I think that's pretty much gone away. I haven't noticed it too much, but I think that, again, once I am able to eat like a hard food, chips, peanuts, something with a crunch, that'll help get that off of my tongue. Maybe the soft foods will, now that I get to chew them a little bit more. That's good. So symptoms essentially are pretty good. I haven't had throat burning. I think I may have mentioned I was spitting up blood very intermittently, but I was, and just small. I mean, maybe, probably, I'm trying to think of an example. Half of the size of a dime, if that helps, or less. But it was enough, and it wasn't like a huge clot or something like that. It was saliva-soaked blood before the procedure, and I haven't noticed that. Other than, again, phlegm, and I addressed that with the doctor. He said that was normal. So I just get excessive phlegm and feel like a buildup in my chest area. Maybe that's also gas, but the doctor all said that was normal and just take some time to go away. Wasn't concerned in the slightest. So all is very well. I really, other than just being tired sometimes, in my opinion, for me at least, the excessive loss of weight. I think I'm down about 11 or 12 pounds now. I forgot to weigh this morning. When I weighed at the doctor, I was more because I have clothes on. But I think I'm probably about down 11 or 12 pounds. To be expected. The doctor said the same, but no concern with that really. Doesn't sound like there's any concern with malnutrition or anything like that in their eyes. I'm not happy about it, but again, I did this for a reason. I knew it was coming. It just not made me happy, but it's just part of the process. And again, if I can get to some normalcy and have a normal life and have a piece of pizza once in a while, or whatever, and just be able to eat like normal and within reason. I'm not going to go nuts, but just certain things I'd like to have once in a while, and I think I'm going to be able to. So far, I'm very happy. I get discouraged at points, but that's just part of who I am, unfortunately, and don't have the most positive mindset all the time, but I am very happy so far, and I think I'm recovering well. Everything's going pretty good, and that's my update on day 15. I'll maybe, if I have issues with eating, I'll maybe post another video, but beyond that, I might wait another week or 6 days or so, and on day 21 to post another video, just because you know, if nothing's changing, then what's the point? So but we'll see how my eggs go down for lunch and my oatmeal goes down, and stuff like that. I have noticed you know, that like they said, you can only tolerate a certain amount of food. That diet book, you know, is half a cup 5 times a day, and you know, I've been trying to have a little bit more protein shake, or a little bit more potato soup blended, pureed, liquid, and it's hard. My stomach can't take it. It shrunk, essentially. I think this is a similar, I don't know if they do a TIF or a gastric bypass, but when I got discharge papers, my wife noticed that it said gastric bypass diet, something of that nature. So I think that's the same thing, where they kind of fold your stomach or whatever for weight loss, essentially, which mine wasn't for weight loss, and I'm complaining about losing weight, but for those that have, you know, had issues with weight and need to go that route of the gastric bypass, it sounds like it's a similar diet to a hiatal hernia and a TIF repair. So I can understand why, you know, you lose weight. You can't eat, your stomach can't hold it. So give it some time, I would imagine, and you'll get back to normal. And I keep referring back to that video that I saw, the guy that was with a year, I don't remember how long again, that was having a glass of whiskey, and I'm just floored. So I'm like, that was what helped convince me. So you know, I'll keep posting, and get 6 months out, a year out, or whatever, and when I can tolerate that sort of thing, I will tell you, and hopefully that convinces you that this is the way to go. And you know, if you've been dealing with this for a long time, you can see some relief, and I have you in my thoughts and prayers, because I know what it's like, but I haven't been dealing with the frequency, intensity, or duration that many of you out there have. So good luck to you if you're going forward, and right now I'd say go forward with it. Oh, also, doctor was talking about the hiatal hernia repair. He wants to see me in a year to do some sort of a different type of an x-ray to make sure that it was healed properly, assuming I don't have any symptoms or anything like that. And but beyond that, I should be good. And he said after a year is when you're really in a safe zone, because if a hiatal hernia is going to recur, it's going to be within a year, is what it sounds like. Extremely high. He didn't give me a percentage, and I forgot to ask. But it sounds like it would be within a year. So once I hit a year, I'd really be safe without a recurrence. So still on lifting restrictions. He said something about 50 pounds, but yet, and I was like, man, the diet book says 10 as of today. First 2 weeks were 5, so today 10. So I was like, I'm not even gonna go there. You know, as much as I like to lift weights and I want to get back to normal, I'm not gonna risk that right now. And especially with my calories, I don't know if I'd have energy to do that. But in any case, that's what I have to do in a year, unless I have issues. And you know, I'm good to go with that. And I see the TIF doctor in 2 weeks, and I'll give you an update on that one as well. So take care, everybody. Talk soon.